Cheers, Pete.
Cheers, Si.
Listen, thanks for coming out today. And sorry for ringing you such short notice.
No, it's not a problem. I was getting cabin fever stuck at home all week. And when you phoned last week and told me, I just didn't know what was going on in your head. I just wish I could have been there for you a little bit more.
Listen, you've been a good friend. I mean, there's not many people you can phone and blurt out, I've just been diagnosed HIV positive too.
Well, that's what good friends are for. But anyway, how are you?
My head's fried, to be honest. It's part of me thinks I'm dying, and the other part is thinks, scared of living with it. I don't know which is scarier, dying or living with it.
I didn't want to push you last week, but your silence was noted.
I was in shock, to be honest. I just keep hearing those words over and over in my head. I just keep hearing, you are HIV positive.
When I was diagnosed HIV positive, I was put on medication straight away. I was scared out of my head, but 4 years later, I'm feeling great, and I must say, life's good. I'm with friends here, and I can get out and enjoy myself. And to be honest, I still look and feel well.
You were saying last week you've got to go back to the Royal. What's that about?
Well, it's to see my consultant, and it's to discuss the levels of the virus in my blood or something. Just saying that scares the hell out of me.
You want me to come with you? It might help to have someone there.
If you could, that would be brilliant. It's next Tuesday morning, 9:30.
Yeah, it should be okay. I've got plenty of annual leave and the boss is brilliant. Speak of the devil, I've got to take this. Sorry.
Go ahead.
I was diagnosed with HIV 15 years ago. I'm not gay, not promiscuous, I don't do drugs, so I didn't think it was something that could really affect me. I didn't think it was at risk. My gay friends would talk about going to a clap clinic. Not something that really came on my radar. I didn't think it was at risk. Then one day I was working in the supermarket at the time, and I just collapsed at work. I was rushed to A&E. Next thing I knew, I was in a room with my parents, and the doctor came in and told me that I had pneumonia. And then he told me, as if like a bus had hit me, there was an AIDS-related illness. I couldn't believe it. I was so shocked, surprised. But I got through it. The poor girl who gave it to me probably didn't know that she had it herself. It would have been a surprise to her too. It was a one-night stand. And, it was the sort of thing that millions of young people around the world do all the time. I couldn't believe it. When I was diagnosed, my CD4 count was down. So I had to start taking drugs, I had to start getting used to my new way of life, and it was difficult. It was really difficult. The drugs were really harsh. But I got used to it. I started to go to places that could give me support. The centre, Positive Life. They were able to give me kind of different, ways to cope, different mechanisms. They introduced me to people from all walks of life, and I mean all walks of life, who had it and were able to speak to me about their experiences. Really, really helped. Now I'm, leading an ordinary life. I got married last year, and we're hoping to plan for the future and having kids and stuff, which is fantastic. For anyone who is newly diagnosed, I'd say, it's not easy, it's really difficult. But just take your time and go and find someone who you can speak to. There's lots of organisations out there, and just make sure that you get used to the drugs and that you see hope in the future, because there really is.
Talk about drama. I managed to get Tuesday off. Where were we?
I was just saying I've got to go and see my consultant, and I've got to discuss the levels of the virus or something.
All right, so we have to go on meds.
I hope not. That just makes it seem so much more real, meds, and it's,
Yeah, but surely won't it be better for you if you are?
Possibly, but I can imagine those drugs are going to be pretty strong. I mean, I don't know.
Well, let's not jump the gun here. Let's, wait till next week and see what they've got to say.
Yeah.
Another pint?
Yeah, please.
Hey there, listen. See that Simon's going through? That's normal. 10 years ago I was diagnosed positive. Things were a lot scarier then, trust me.
Yeah, mate.
Cheers. Thank you. When I was finished talking to the consultant last week, I was sent to see one of the counsellors, and she mentioned a place in Belfast where people with HIV can go for support. Positive Life.
Yeah, I was going to say, I was looking at Positive Life's website. They're on James Street South.
Yeah.
Yeah, maybe you should go, you might enjoy it.
Maybe, but the thought of going somewhere where there might be a lot of gay men, you know what we're like.
Sorry, HIV isn't a gay disease. I'm sure they have a code of conduct that keeps, that kind of thing private.
I volunteer with Positive Life, and we support people living with HIV regardless of race, gender, sexual orientation. So come along, you never know, you might even enjoy yourself.
Early days anyway, enough of my lack of love life. You told anybody else yet?
Just my GP. She signed me off work for a couple of weeks just to get my head together.
That might be good, because then if she's prescribing you medication, all the interaction and stuff.
But I really don't think I'm going to tell anybody else.
Oh, well, that's up to you, Si. I'm sure in a couple of months' time you might change your mind.
Listen, after this, should we call a cab?
No, Chippy.
You and your chips, little pickers.
We're big knickers.
Well, here we are.
How you feeling?
Nervous, to be honest. I mean, this time last week I was getting my HIV result, and here I am a week later to discuss meds. I mean, it's all just a bit scary.
I wouldn't worry, these people are here to help you.
I know, but...
There's no but, mate. I'm sure there's people sat in this waiting room worse off than you.
Simon Collins.
That's me being called.
Do you want me to come in with you?
Could you please?
Come on then.
I was diagnosed 3 years ago. I had lived a very hedonistic lifestyle. Sex, drugs, drink, you name it, I did it. I had been selling my body as a prostitute just to pay for my drugs. I was addicted to heroin. Nobody was surprised when I got diagnosed, or that's how I felt. I had been arrested by the police for shoplifting. I was in prison, taking drugs, even in prison. I found a way. And when I was in prison, I got so ill, I was sent for every blood test you could think of. They didn't know what was wrong with me. I was wasting away. I never thought of HIV. I had been having sex, I'd been sharing needles, I'd been doing everything and anything, but I never thought of HIV. I was sent to get all these blood tests done, and when they came and sat me down and said, "Have you heard of HIV?" I was, "What?" But then I thought, well, actually, no surprise. Nobody's going to have any sympathy for me. The lifestyle I had lived, drug addict, thief, in prison, nobody's going to care. Nobody's going to mind if I die. That's how I felt. I was in such a dark place. In prison, they gave me counselling. They sent me to the Royal Hospital for the gun clinic. I got treatment. I got counselling to help me with the HIV and also with my drugs. I'm now in a good place. I've been seeing the folks at Positive Life. I've been getting support. I've been getting counselling, aromatherapy. I've been getting all the things that have changed my life. I've now got my own little flat that's mine. I'm not taking drugs. For many years now, I've been off the drugs. I very rarely have a drink, and I haven't been having the mad lifestyle. I'm now got a part-time job. I'm working, supporting myself, and life's actually good. But when I was first diagnosed, I really thought, this is it, I'm going to die. Nobody cares. I've realised that there are people who care. The counsellors, the support I've had from the people at Positive Life, everything has helped me come through this. And now I actually am having a good life.
Well, how do you feel now you've spoken to your consultant?
To be honest, I didn't really take on board much of what was being said. I know I've got to start taking meds straight away, but I didn't listen, to what the meds were or what the side effects were going to be.
Well, I did take some notes. I've got some information from around the waiting room. Let's go back to my house, chill out for a bit, get it over with, and check the internet maybe.
Did you know that there are 1 in 5 people who are HIV positive that don't actually know that they've got it? That's why it is important to get tested regularly.
Yeah, you're right. Listen, I'll just grab a table.
When I was diagnosed, thought my whole life was over. Thought that's it, all the doom and gloom stuff that goes with that. I met this lovely guy 3 years ago. We're getting married next year. We've even talked about having kids. Need to give these up though first. See all that diagnosis stuff, don't worry about it yet. Just get used to having your diagnosis. See how you are with that, and then you can talk to somebody about that later.
Cheers, Peter.
Cheers, Si. How's your first week been at home on your own?
Oh, it's been fine, it's been okay. My sister Karen phoned during the week and said she was popping around, and I'd left my meds out, and they were lying around, so I was a bit paranoid about leaving them around, but it's been fine.
I wouldn't worry about it. Your sister's brilliant anyway. Why don't you set an alarm on your phone or something?
Actually, that's not a bad idea. I hadn't thought about that, because I'm a bit worried about forgetting to take them, because I've got to take them at a certain time every day.
Any side effects?
So far, so good. But remember, the consultant said that it could be 4 or 5 weeks of taking the meds before I would notice anything.
Well, I'm not going to worry too much about it.
You've got the right attitude. I'm kind of hoping, I'm looking forward to getting back to work. I'm kind of hoping I'll get back soon.
Whoa, Tiger, it's only been 3 weeks.
I know, but it'd just be nice to have something else to think about other than HIV.
You'll be okay.
Actually, you know what? I think I will. I think everything's going to be okay. Listen, thanks for being there for me. I really appreciate it.
That's all right.
I'm a clinical psychologist working specifically in the area of HIV. I'm employed by the Belfast Health and Social Care Trust, and I work there as a part of the team, part of the Regional HIV Treatment Centre. I suppose my role within the team is to provide psychological support, to provide a clinical psychology service into the treatment centre itself, but more specifically the people living with and affected by HIV. I suppose the important thing to say is that at the point of new diagnosis, there's a complete broad spectrum of emotions that people will go through. People will use the word depression and anxiety to describe their emotional state at that time, and that's very reasonable, that's very valid. So it's important just to say that not every feeling will develop into a condition such as depression and anxiety. They're two very distinct psychological, psychiatric conditions in their own right, and a traumatic event or diagnosis of a physical health condition won't always lead to something like that. It's very important to say that. But the feelings that people have at the point of diagnosis of feeling distraught and upset and hopeless and angry and anxious, they're all very valid reactions to a diagnosis at that point in time. I believe there's research evidence out there that says that people living with HIV are an increased likelihood to experience depression and anxiety. And yes, I can see why that might be, because of the stigma that's around in society and that's attached to the condition itself. It can very often cause people to have very negative ideas about themselves. But it's important as well to say that those feelings can be transient, they can be managed. People find a lot of very, very positive ways to be able to manage them, to move through that process of adjustment and hopefully come out the other side of it. With ways and strategies to manage the feelings, but also with a different perspective on what has just happened. In the early days post-diagnosis, and for people, for the number of people who find it difficult to process and make sense of diagnosis and come to terms with it, yes, absolutely. Those terms come up quite a bit: self-hate, self-loathing, feeling dirty, feeling responsible, blame. They're all very common, and I think it's important to realise that they are products of stigmatising processes within society. That just because we feel those things about ourselves doesn't mean that they are true, doesn't mean that they represent facts, doesn't mean that we are dirty, that we are hate-worthy, that we are this, that we are that. They're much more reflective of social stigma. They're much more reflective of the narrative that is around about HIV in society. And that narrative is around about HIV due to people's lack of awareness and lack of understanding as to what HIV is. I mean, I think the thing to remember is, in the early days after diagnosis, it is very normal after receiving news of a diagnosis for people to feel distressed. It is very normal to feel depressed. It is very normal to feel anxious. It's very normal to feel numb. I mean, there are a lot of emotions there that I would say are pretty normal reaction to quite stressful news or quite stressful event. And it's important not to make that a bad thing or make that mean something about your mental health. Yes, psychologically it's very demanding and it's very difficult and it's very distressing, but I don't think it's helpful for people to think that they're not coping. I think that is part of coping. I think part of coping is going through those emotions because it's part of the process. I mean, I think it's very important for people to look after their psychological well-being generally, and I suppose in the early days post-diagnosis it's about focusing on what do I need to do now. It's about trying to stay as present as possible and think about what are the benefits of discussing this with somebody that I trust. If I can't find anybody that I trust to discuss this with, then can I go back to the clinic? Can I speak to one of the doctors? Can I link in with a counsellor? Can I attend Positive Life, which is HIV support charity here in Northern Ireland? Can I link in with a counsellor somewhere else? Can I link in with psychological services at the clinic? Absolutely. I've seen people that when they get through the initial diagnosis, when they move through that process of adjustment that I talked about, how they can take HIV or take something that was once a very difficult experience for them and turn it into something that's very positive and make it have some sort of meaning in their lives, give them something to find a way to help other people through. People talk about it being a pivotal point from which their lives changed in a lot of positive ways. I have to say not everybody, I haven't experienced that with everybody, but yeah, I've seen that happen where people tap into their own personal resilience and their own sort of personal agency. Don't allow it to become all-encompassing, but use it to help them, I suppose, find meaning in life.
Very good.
In the research literature, it's referred to as post-traumatic growth. I would say that what I would say to anybody at that point in the process is that it won't always be like this. It will be difficult, potentially, in the early days. It may be difficult, but it won't always be like this. It will improve. I would say to people, you will find a way to make sense of this. You will find a way to negotiate a path through this, and all the opportunities of life will be available to you again. I would say to them, if you feel distressed, upset, feel that things are becoming difficult, talk to your doctor, tell your doctor in the clinic. There is a lot of help and there's a lot of support there to help you through this at this time. There's a lot of help and a lot of support to help you there through any challenges that may arise as a result of moving through this journey with the diagnosis of a new condition. Step forward. If you can't tell anybody else in your life, then come forward and tell somebody at the clinic, or tell somebody at Positive Life, or tell somebody in one of the supporting organisations, but do tell somebody. You don't have to do this on your own, is essentially what it is.
Alphabet HIV stands for Human Immunodeficiency Virus. It's just a name of virus. The H part, human, obviously means that it only affects human being. It affects our immune system and causes it to be weakened, and that's the word deficiency, and obviously it's a virus. Can it be cured? Well, it can be very well controlled these days. The drugs works very well and can fully suppress the virus, but not cure as in to have a short period of drug and then stopping it so that the virus don't come back. Unfortunately, we don't have that yet. When we see our patient for the first time and as ongoing monitoring, we would often do a series of blood tests. And two of the blood tests that we do would be the CD4 count, which is often also known as T cell, and also the second blood test is the HIV viral load. The CD4 count is a marker of the effectiveness of our immune system. The normal CD4 count of a person is normally over 500, and we would use that line to estimate the need of treatment and whether the person's at risk of opportunistic problem. In terms of the viral load, it is the measure of the amount of virus the patient has in the blood, and that would be usually used in the context of monitoring effectiveness of the treatment, as the aim of the treatment would be to get this viral load fully undetectable. Other way where one might imagine bodily fluid could be contaminated, things such as like what you say, sharing the same toilet, using the same cutleries, sharing the same bathrobe or towels, or etc. That thing. They are not really a way that HIV passes on, because this virus ultimately lives in blood and it doesn't actually survive in the environment very well. So once outside the human body, the virus very quickly denatures itself and loses its ability to transmit. There is a study in America that has looked at the transmission of HIV when their people are fully suppressed, and the evidence from that study would suggest that actually transmission is very, very much reduced when people's viral load are fully suppressed. So,
do you have any sort of numbers for that? Or?
In the study, it actually showed that it's almost none, but unfortunately, like study is always only study of a certain group of people. You can't generalize it to absolutely zero, but people are really talking about at least 92% reduction in transmission risk, and that when compared to say safer sex like condoms use, if consistent condom use is actually equivalent or better. So therefore HIV drugs are very, very effective in reducing transmission. Now, in the era where we expect our patient living with HIV to normalize their life, that does mean that we should also expect them to have the expectation of having a normal sex life. But obviously the issue around sex would always be, is it about with a partner that people know that there are no other sexual health concerns? Because while the focus may be about the HIV, we would always want to highlight the issue of possibly acquire other sexual transmissible disease. So our patient should often consider frequent sexual health check if they have concern, and that's again back to discussing about testing for chlamydia, gonorrhea, hepatitis B, hepatitis C, and syphilis. And for hepatitis B, they already should be pursuing vaccination. We in this province has now managed over 100 cases of women living with HIV that became pregnant and actually successfully have children that are affected by the HIV. So the possibility is definitely there. Half of these women that were managed actually are first diagnosed due to the antenatal screening program picking them up, but actually half occurs in cohort that we look after, and that discussion we often would have had well before they're when they're at the stage that they're planning to have a pregnancy. And the reason why we can actually successfully reduce the chance of passing from mother to child is because of effective treatment that we have. Our current British guideline would suggest that less CD4 count of less than 350 would be a definitive indicator to start treatment. Obviously, there's a range of between 350 and 500, and we often would advise our patient to look at the trend. If that trend is holding quite well near to the 500 mark, it is an option for patient to wait. But if the trend is that it is a downward decline over a period of time, it may be advisable obviously not to wait until they drop to 350. But I say there are actually many other factors that we would take into account to discuss with patient. But sometimes some patient would actually opt to take treatment even their CD4 count is well above 500, and there are many other reasons for that there. And one and more frequent one people often do discuss with us is that prevention of onward transmission, especially if they're in a regular relationship with a discordant couple. We now have options of less tablets regime, like one tablet once a day regime or 2 tablets once a day regime. They are all very effective, and side effects are becoming less common, especially long-term side effects. Of course, when people first start treatment, very common they do suffer from short-term initiation side effects, and we still have that there. But those are very often self-limiting, and I'm referring to things like GI upset, some gastrointestinal upset, nausea, vomiting, a mild rash, but those frequently goes away shortly after the first few weeks of initiating treatment. I always would like to encourage patients to understand that GP is part of the healthcare professional to look after them. So disclosing to GP is very important, and we would strongly encourage that. Ultimately, the choice do remain with the patient, and patient do have the right of choosing not to inform their GP, but we discourage that. And why is that there? It's because that GP would be very good at looking after every other aspect of care outside HIV, and HIV specialists would never be as good as GP to look after things outside the remit of the HIV and GU care. It's very important that people living with HIV do not forget the health message that otherwise we would promote to everyone that lives in Northern Ireland, and that's actually staying healthy. And what is maintaining good health? Well, It's the same message, don't smoke like a train, don't take regular exercise, eat healthily, and that means cut down fat, cut down sugar, and that sort of 5 portions of fruit and veg a day. I think the message is actually no different. Most of our patients living with HIV, if they adhere to their drug advice and drug regime, and obviously we can tailor to find the regime that suits them best, they should actually expect to have a normal life expectancy. We offer a multidisciplinary team support in our clinic, and our clinic would contain many different disciplines of profession that in order to provide a holistic care to HIV. So apart from the clinician and the nurses in our clinic, we would have social service, clinical psychologists, psychiatrists, HIV specialist pharmacists, HIV specialist nurse. Across the hospital as well, we have access to all the other medical specialty, including other supportive teams such as dietitian and OT physio. Not only just that, then we will often direct our patient to look at resources such as Rainbow and Positive Life, who may have more information and advice and support network which people may wish to utilize when they're newly diagnosed, as well as actually ongoing care.
Hi, my name is Rory Thompson. I'm support worker at Positive Life. Just want to take the time to say thanks so much for watching this clip. The stories are real, but some of the parts have been played by actors. Not everyone involved is living with HIV themselves, but they care enough about the issues to have started and been involved in this production. You might be going through a really difficult time at the moment, but just please know there is help and support out there for you. You mightn't feel like speaking with your friends and family just right now, so why not think about maybe giving us a ring or popping down to see us. We're here to help you. Our contact details will be coming up at the end of the clip. We have a wide range of free services at Positive Life, everything from yoga to complementary therapies, just to a place to come and talk to someone, either one-to-one or in a group setting, and it's all in the strictest of confidence. Our monthly support group meetings are a great way to meet other people living with HIV, just to share experiences and to support each other. So just once again, thanks so much for watching the clip. It really means a lot to everybody who's been involved in making it, and I certainly hope it's helped you.
On behalf of HIVE, I would just like to thank everyone involved in the production of this DVD, including the Belfast Unemployed Resource Centre, who've been funded by the EU Peace 3 project.